Chapter 13, Students with Orthopedic Impairments, Traumatic Brain Injury, and Other Health Impairments. The focus of Chapter 13 includes students whose educational experiences and ability to learn are affected by their health or physical disabilities. This includes students whose illnesses or disorders are not readily seen but still affect their strength, memory, attention, sensory processing, ability to communicate with others, behavior, and learning. To better understand physical and health disabilities, it is important to identify how they affect the individual. Some conditions are chronic, acute, progressive, or episodic. Conditions that are chronic indicate they exist all the time. They show little change and they currently have no cure. An example of a chronic physical condition is cerebral palsy, spina bifida, or spinal cord injuries. Conditions that are acute can be treated and possibly cured. An example of an acute condition is childhood cancer. Conditions that are progressive indicate they get worse over time and may lead to death. An example of a progressive condition is muscular dystrophy. Conditions that are episodic indicate they occur with intensity, but at times they are dormant. An example of episodic condition is epilepsy. So along with identifying how health or physical disabilities affect the individual, it is important to identify the cause. Some health and physical disabilities are congenital or acquired. Disabilities that are congenital or present at birth may be genetic or hereditary or the result of an environmental influence during pregnancy, such as drug or alcohol abuse or injury to the mother or child. Disabilities that are acquired occur during or after birth. So examples include trauma during delivery or later as a result of an accident, illness, injury, or environmental factor. Students with health and physical disabilities have diverse needs influenced by the type of limitations they experience with their disability. So this may lead to misperceptions that students with disabilities cannot learn as much as others. So it is important for educators and other professionals to determine how the students' limitations may influence the type or amount of instruction they receive. Educators and other professionals are encouraged to be flexible in their planning, using various resources to modify their educational environment, including classroom management, encouraged to become knowledgeable about different learning styles, and to be creative to provide students with meaningful learning experiences and encourage engagement. The educational environment and instruction for students with health or physical disabilities should be designed to assist them in developing their motor and communication skills to provide experiences that support their learning. To apply what you learned in Chapter 13, review the section Identifying Physical and Health Disabilities, pages 403 to 404, and reflect on the following questions. Which assessment procedures are included when considering eligibility for a student with physical and health disabilities? And why is it difficult for some students to be assessed? Then review the section Recommended Educational Practices for Students with Physical and Health Disabilities, pages 409 through 412, and reflect on these following questions. What special education considerations must be made for students who have severe physical disabilities? What are some other ways to facilitate integration of students with physical or health impairments into the regular classroom or the general education classroom? What is an example of one of the considerations regarding mobility that should be addressed for students to stay healthy and learn effectively in school? As a reminder, this activity is not a required assignment, but provides an opportunity for your reflection and to apply what you learned in Chapter 13.